Hypertension or high blood pressure, also known as silent killer. So what is hypertension? Our bodies can only function when they are provided with oxygenated blood. The heart beats and creates pressure that push blood into blood vessels. So blood pressure is the force that the heart exerts to get some blood to all parts of the body. The more resistance the blood vessels have, the harder the heart has to work. Hypertension occurs when the blood against your artery wall is high enough that it can lead to more issues. The more blood your heart pumps, the narrower your arteries will be and the higher your blood pressure will be. Over time, force and the friction can damage the delicate tissues inside the arteries. This just leads to more problems only. The LDL cholesterol, the bad kind, starts forming plaque in the tiny tearing artery walls. As more plaque accumulates, the damage only increases. The arteries become narrower and narrower, raising the blood pressure to unimaginably high rates. The vicious cycle continues and can lead to conditions such as arrhythmias, heart attack, and even stroke. Primary hypertension has a lot of factors. This include blood plasma volume, the hormone activity in people, and any medication they might be using. Environmental factors such as stress and sedentary lifestyle can add to this condition. If there is another condition that is causing an increase in blood pressure, then the doctor refers to it as a secondary hypertension. CKD, a chronic kidney disease, can often lead to hypertension. When the kidney no longer works efficiently, there is excess fluid present in the body. Other lifestyles and diets, there are a number of factors. Age is one of them. Hypertension becomes more common in people who are above 60. Blood pressure can increase steadily as their arteries stiffen up and become smaller due to plaque buildup. The second risk factor is ethnicity. It is proven that some ethnic groups are more prone to hypertension than others, such as African and American. Thirdly, alcohol and tobacco can increase blood pressure by a lot. Regular consumption of alcohol and tobacco can also lead to other health conditions, so it is better to stay away from them. Tobacco can immediately raise your blood pressure for a while, but the chemicals in it can damage the lining of your artery walls. Second-hand smoke can increase the risk of heart disease. If you do have a habit of smoking, then avoid smoking around others as it can be injurious to others as well. Other than that, if you have a family history of high blood pressure, then you should take more care of your blood pressure. Lastly, if you don't have enough potassium in your diet, then there won't be a balanced sodium in your cells. With the right amount of potassium, you can keep your heart healthy and happy. However, if you don't consume enough of it, it can lead to dehydration too. The heart is probably the most vital organ in your body, so taking care of it is crucial.